We are back on Morning Line. Our guest, of course, is Clint Kelly. We're talking malpractice. The number, 737-7587. We've got some calls on the line here. I want to get to them, and the line's open if you want to jump in. They're filling up. But couple of things real quick. You talked about you're seeing a lot of cases involving blood clots.
Correct.
And is there something that you think has changed that's bringing that about?
No question. The Surgeon General has determined that blood clots are the #1 leading cause of preventable death in hospitals today. The Surgeon General issued a call to action about 2008, and this got into all the hospitals across the country to start developing policies and procedures to handle patients when they come into the hospital to prevent blood clots. And patients develop blood clots when they are immobilized, typically after hip surgery, arthroscopic surgery, or even open surgery. When they don't get to move around a lot, that blood pools, and then once it congeals, it can break off. A piece of it can break off and go all the way up your bloodstream and lodge in your heart and kill you.
Or your brain, right? You have a stroke from that?
Typically, though, it's a pulmonary issue.
Okay.
Anyway, long story short, these hospitals were supposed to develop these policies and enforce these policies. The way to prevent this is pretty standard. You give people a shot of what's called heparin.
It's a blood thinner?
Anticoagulant.
Anticoagulant.
Yeah.
Okay.
You give a shot of this stuff, and this tends to prevent clot formation and prevent someone from having a terrible result. Well, the hospitals, for whatever reason, have been very slow in implementing these policies or enforcing the policies. So some patients who should have shots aren't getting them. And then the other device that's used is called a pneumatic compression device, which is basically a sleeve that inflates with air and it squeezes the legs or the calves. You've probably seen them before.
Sure.
A little hose that's hooked up to like a machine. It works like a vacuum almost. And that compression, inflation, exflation keeps the blood from pooling in the legs, and again is another way to prevent clots. Well, for whatever reason, the nurse, well, I know the reason, the nurses are not keeping those sleeves on correctly because it's very time intensive. You've got to check on them regularly and make sure they're secured properly. And if they're not secured properly, they just simply won't work. I mean, if they're loose, you're not going to get the compression.
Right.
So anyway, we're having patients or their families call up and say, hey, you know, Joe had a blood clot. I've got a case right now in Memphis, set for trial 3 months from now, who died, 35 years old, went in with a back ache, was waiting for a pain management consultation. 3 days later, died from a blood clot.
Did he have a surgical procedure? Or?
No.
Oh, so he went in, he had a backache.
He had a backache. The emergency room physician decided to admit him to the hospital and have him be seen by a pain management specialist and ostensibly to get an epidural steroid injection. That was going to give him the pain relief.
Okay.
Well, the consultant never showed up. And so the man's sitting in his bed day after day after day waiting for this consultation that never happens. Well, at the end of day 3, he has a blood clot break off, lodge in his lungs, and it killed him.
What was causing the back pain? Was there a herniated disc or something?
Yeah, slip disc.
But so it congealed because he just sat there.
Because he just lay there. The order was for bed rest. So basically what they're saying is you don't get up, you don't move, you lay in bed.
Which creates a clot.
Which creates a clot.
So what should, okay, now I understand the rest. So what should they have done to allow him to rest without having that problem? Did they need to give him a shot?
Give him a shot.
They didn't give him
a shot.
So your argument is you didn't follow the standard of care because you did not provide him with the anticoagulant,
right,
and he ended up having a clot.
I will promise you, some people watching this show right now have had those shots. They're shots that are typically given in the stomach. They're called heparin sub-Q. They're usually given 2 times per day during the hospitalization. And like I said, it prevents blood clots the vast majority of the time. But for whatever reason, some hospitals are not enforcing that procedure, and some people are dying because of it.
It's interesting because when you first brought that up, I thought you were relating it to after a surgical procedure, but it could even be someone who's come in with some type of trauma or a slipped disc. Or, I mean, if I have a bad contusion on my leg and they just set me down there and leave me without moving and there's that blood pooling there, that's where I would need a shot. The standard of care is give them that shot.
Trauma is a perfect example. Somebody who's been in a terrible highway accident, maybe gets life flighted to Vanderbilt. They go to the trauma unit. They may be laid out for 4 or 5 days, with a cast on their leg and can't get up and get around. Well, Vanderbilt has a policy that says those patients are supposed to get blood thinners.
And that's pretty standard then. They come in, you give them that to protect it.
Absolutely.
So if they don't, and again, that's what we talk about, standard of care, whether or not, if it's not done, then they missed what is accepted in the medical community as what they should have done. That's where you have a case.
That's correct.
Man, that's interesting.
Yeah.
Wow. All right, listen, let's take some phone calls. More to talk about along those lines. We'll start off with Joe. Joe, good morning.
Good morning, Nick.
Hey, Joe, what's on your mind?
Mr. Kelly, I just want to give him a shout out for coming on and giving this good advice to people. and have a couple of comments on. For anybody that's going to have any kind of surgery, especially major surgery, do your due diligence and check on the doctor. Look him up and see what kind of record he's got, what kind of rating he's got. Ask around from other people and check it out as best you can before you go to these doctors. And it's Mr. Kelly well knows, like he's just got through saying, blood clots and infections in hospitals are two of the most common ailments that come when you go to a hospital. If you come out without an infection or blood clots, you're lucky. So that's the way that goes. But I want to defend one segment of the medical profession, and that's the nurses, because hospitals, they're working these nurses 12-hour shifts, and they're loading them up with patients, several, 4, 5, 6 different patients to look after. So they're stretched pretty thin. So a lot of them are doing the best they can do to try to keep up with, like putting these compression devices on their legs and stuff to keep down blood clots. But they're stretched pretty thin on this stuff. So.
Yeah, I mean, you make a good point. I wonder what your thoughts are on that. Maybe it's the culture of what happens in hospitals, be it nurses being overworked, or I've had friends who have gone through residency who talk about being on like these 14-hour shifts. And I'm fine if I'm seen within the first 5 hours of that. I don't want to be the poor guy who comes in with horrible trauma on the 14th hour, but it just seems like hospitals have this system set up where you work these super long hours or you're overburdened with 5 patients, and humans are going to make mistakes under that kind of stress, right?
All right, well, let me address Joe's points. He's raised a lot of great points that I want to talk about, take a few minutes to talk about. First of all, nurses nowadays are basically practicing medicine.
That's right. I agree.
A lot of people don't want to hear that, but that's the truth, and it's because of the way modern medicine has evolved. More and more critical decisions are being put on nurses to make because it's cheaper and easier, and it frees the doctors up to do other things. And so that's the way it's going to be for now. Well, it's just the way medicine is right now, because the hospitals work on a profit motive, and there's only so many people they can hire and work to maintain a certain amount of profit. So it's about efficiency.
Right.
Number 2, nurses are overworked. There's no question about that. One thing that can help a nurse is a nurse can have what's called a certified nursing assistant. We used to call them orderlies back when we were younger.
Is that the same thing?
But they are now trained medical assistants who come in and do a lot of the work that the nurses used to do. They can give shots. They can take temperatures, they can take vital signs. They also can make sure the sleeves are put on the legs properly, make sure they're tightened, so they can come in after the nurse to supplement what the nurse is doing. So that does give some assistance to the nurses. But again, what's happening is you're going to have more and more nursing decisions placed on the certified nursing assistant. And if the certified nursing assistant doesn't know how to recognize problems, signs or symptoms of a complication or an issue, they may be the weak link in the chain. So the bottom line is we get older and we start going through the medical system, those of us who start getting our 60s or 70s or 80s, we're going to have more and more of our decisions made by nurses, nurse practitioners, and in some cases certified nursing assistants, and we may not even see the doctor but once. And that's just the way it's going to be.
Okay, and if that's the case, then you're going to want a more experienced nurse, I suppose, right? I mean, where did they learn? I mean, doctors are doctors because they have all this schooling. These nurses are there, they see things, and they're not, you believe they're stepping over the bounds sometimes and doing things that they are not medically qualified to do?
Yes, I do. I've seen it. And, and it's not something necessarily that they're doing without the hospital giving them some authority to do. Implied authority to do. When you are overworked and you only have so much time to put into a patient and something needs to be done and the nurse knows it needs to be done, a lot of times the nurse will say, I'm just going to do it because I think it needs to be done, even if it's something that the doctor should be doing himself or herself, or maybe getting a physician assistant to come in and do it. But in today's medicine, the registered nurse now, I think, and the nurse practitioner has got most of the regular daily decision-making authority. The doctor just signs off on it after the fact.
All I know is every time I talk to you after the show, I just think about doing everything I can to stay healthy.
Stay out of a hospital.
Yeah, and stay out of the hospital is my point.
Well, and the last thing Joe talked about is infections. And, Joe, it's a lot easier to guard against a blood clot than it is an infection, because at least with a blood clot, there is a way to minimize that. A lot of strategies to minimize and reduce that risk. With infections, hospitals are teaming with them. I mean, he's right. You're lucky to get out of that.
You're talking about MRSA? Is that it?
Yeah, MRSA. You remember, Nick, we were talking about that study, I guess, a couple of months ago about how many people get infections going into the hospital. The numbers continue to rise. And one of the doctors, I was on the show last time with Carrie a couple of weeks ago, one of the doctors that wrote a report on this said, what's the number one thing doctors could do to reduce malpractice cases? Wash their hands.
Yeah. You've told me that before. I assumed they did wash their hands.
All of us do.
Boy. Let's go to John. John, good morning.
Good morning.
Hi, John.
Hey, can you hear me now?
Yes.
I got a question that I've been trying to get answered. My wife died in a rehab center, and I've been trying to get her records and everything, and they won't release them to me. Is it a time limit on when you can take legal action for wrongful death?
Well, we were going to hit on that sooner or later, but when did your wife die? I'm just curious.
She died 2 years ago.
Okay, sorry for your loss. Yeah, go ahead, Clint.
The statute of limitations in Tennessee is 1 year from the date that the patient or the surviving family member discovers the injury. Now, there are exceptions to that, but they're pretty tight. So anytime you suspect something has happened that is the product of medical negligence, your clock starts running from that day up until 12 months. And if you don't file pre-suit notice on that 365th day after you suspected an injury, then you're likely going to be barred from having your day in court.
And how difficult is it for someone like a widower like him to get medical records from a deceased wife?
It can be tough depending on the hospital that you're dealing with. Most of them will provide it to the surviving spouse, but I've had some cases where you had to go to court and have the court appoint the surviving spouse an executor or an administrator of the estate to get access to those records.
Is there a reason for that? I mean, at this point, HIPAA, I don't know, does that really still apply once you're dead? I don't know, maybe.
Oh, yeah, the patient still has HIPAA protection even after the patient dies. You still have to follow the HIPAA rules, but there's nothing in the HIPAA that I'm aware of that says a surviving spouse cannot get the other spouse's records. It just depends on, some healthcare providers take a very strict approach in that regard, and like I said, if you need to, you can go to the hospital, to the court and bring to the hospital letters of administration to force them to give the records up.
As far as getting your own medical records,
you can get them, no question.
And that's where you call your doctor and say, I have a new doctor, I moved, I want you to forward them to me or forward them electronically to my new physician?
Correct.
And that should be pretty straightforward. They're your records, they're supposed to do that.
Usually you can get them that day.
Yeah, okay. Just want to make sure. And if not, then that's something, you need to bring up. There's a problem there. Let's go next to, I think, Arthur. Arthur, good morning. Are you there, Art?
Yeah.
Hey, go ahead, Arthur.
Yes, I was just sitting there listening. Joe answered most of the questions that I was going to ask. I'm just trying to figure out what is this name and what is this number, and how can I get in touch with him? But I need an attorney.
Okay, so you think you've got a case, huh?
Yep, I know I do.
How long ago did it happen?
Back in 2007, and I'm under doctor care and all that.
Well, that's the problem. See, you waited too long. If it was 2007, unless something else done, you have 1 year to pursue a malpractice case.
Okay.
Yeah, I'm sorry about that. I wonder what his situation is. And by the way, we do give out Clint's phone number and address. Stay with us at the end of the program, and if you don't want to call in but you want to call directly to his office, that's fine. But yeah, no, we didn't stay on with him beyond that. But
the only exception,
that's the problem.
Only exception that he would have would be a situation where, say, an object was left in his body, a sponge, hemostats. Sometimes that happens. Or if there was provable fraud on the part of the doctor or the healthcare provider, which is just virtually, it's the tiniest percentage of cases.
Where you would have been completely misled or lied to or something along those lines. The last caller that we had last time that might have been a case was where they did leave, it appears, something in his mouth. Now, you also handle dental cases,
correct?
That's correct.
That's correct. And this was a case where it appeared that the pick that was used to work around the tooth had broken off and lodged itself into the man's socket where the tooth was taken out, and he didn't find out until later, after another dentist was investigating the reason why this guy was having pain and complications. took another x-ray back there, and there it was.
Now, just with relating to that and standard of care, all right, this could have been, now, again, it's wrong. Don't get me, thinking that I'm siding with the dentist here, but you have a pick and it's in there, and the very end of it cracks off while you're just doing normal cleaning, and you don't catch it. It's not like you did it intentionally. It wasn't a standard of care thing. I guess you should have looked at the end of the pick and saw it
You
broke.
just answered your question.
Okay.
If I'm sitting there working on your car's engine and
you're right,
part of my screwdriver breaks off and the tip falls into the oil gasket and seizes up your engine, I'm not going to sit there and say, well, gee, I'm sorry, Nick. Bad things happen to good people. Good luck.
No, you're right. I was just trying to figure out what a defense might be there.
Check my screwdriver when I pull it out and make sure it's
that
not
it's
broken.
intact.
Right.
Exactly. I don't want to go to court with you, man. It'd be tough. All right, listen, we'll take a break. We come back. More of your phone calls, more of our conversation. We've got lines open, and I know we had a few people on that fell off because it was getting busy. 737-7587 if you want to join in the conversation, talking medical malpractice right after this.